Third day in Madrid. Affluence matched the yesterday record number, 19,857 attendees. Hot topics: Presidential Symposium, Gastrointestinal tumours, lung cancer, breast cancer. Three top studies discussed at Presidential Symposium. Johan van Steenkinste from University Hospital in Leuven presented MAGRIT, a double-blind randomized placebo-controlled phase 3 study, the first one to investigate immunotherapy in adjuvant setting of non-small cell lung cancer. The trial confirmed that vaccines are very well tolerated with mild side effects, even though MAGE-A3-CI showed not to increase disease-free survival, but the study confirms that. Tony Mock from University of Hong Kong revealed the results of a phase 3 randomized IMPRESS study. They confirmed chemotherapy as a second-line therapy after disease progression, as data did not support the continuation of gefitinib in addition to chemotherapy. Finally, the Cleopatra study. It has defined an unquestionable therapeutic success with an unquestionable clinical implication.
The Cleopatra study was a first-line study in patients with HER2-positive metastatic breast cancer, and they were randomized to receive pertuzumab, trastuzumab, and docetaxel versus placebo, trastuzumab, and docetaxel. And the results were stunning in that they showed a 15.7-month improvement in overall survival. This was on top of an already good survival in those patients who received trastuzumab without pertuzumab. So this is really an unprecedented result. The implications are, because of looking at all the patients on the study, is that any patient who has metastatic HER2-positive breast cancer should be provided with pertuzumab and trastuzumab with chemotherapy in the first-line setting.
Today's highlights. Crizotinib is a standard first-line therapy for advanced ALK-positive non-small cell lung carcinoma. Profile 1014 study results, presented by Ben Salomon from Peter McCallum, confirmed it. The randomized open-label phase 3 study compared overall and intracranial efficacy of ALK-targeted therapy with standard chemotherapy, crizotinib and next-generation ALK inhibitors. How to make a choice? Next-generation ALK inhibitors are active in patients who relapse on crizotinib, Alice Shaw from Massachusetts General Hospital in Boston answered. They represent a new standard of care. Little is known about the immune and genomic landscape in metastatic breast cancer. To assess this critical issue, a secondary study of the SAFIR-01 and Mosquito trials that had previously performed molecular screening of patient biopsies was presented. The new analysis identified a pool of genes that are potentially involved in resistance mechanism or migration process of metastatic cancer, also suggesting that other immune suppressor networks exist. This has to be further investigated. Which is the best treatment and management of a critical case? At ESMO Clinical Practice Guidelines sessions in the afternoon, oncologists found the answer. Top discussions: advanced melanoma, gastric marginal zone lymphoma, cervical cancer, head and neck cancer, gestational trophoblastic disease. Are physicians globally aware of the value of biomarker testing?
Yes, the results of our survey have demonstrated clearly that among the interviewed oncologists that treat patients with breast cancer, colorectal cancer, or non-small cell lung cancer, there is a clear awareness of the role and relevance of currently available molecular biomarker testing for appropriate predictive value to choose the right therapeutic options. This is an important news because more than 90% of these physicians were aware. The problem is that only 50% of them were answering that in real life, in clinical practice, they are able to translate their knowledge to the application of the molecular testings. This is still not very comfortable, because this means at least in one case out of two, potentially important molecular predictive tests are not performed for our patients. Another important issue is that although most of the patients are potentially ready to take the test and are even willing to take an extra biopsy for having their tumor material tested for meaningful molecular tests that could predict the use of specific therapies that are helpful for them, although the patients have this knowledge, according to the physicians that were interviewed in our analysis, only 25% of them, 1 out of 4, are currently clearly informed of the role of molecular testing for the best management of this disease.